610 WTVN.
A pleasure to welcome Dr. Katie Jarvis back to the air. Doctor, how are you this morning?
I'm good. How are you this morning?
Doing super. You know, last time we chatted, we talked a little healthy living. We talked a little bit about what's going on in our regional hospitals around the country. I know you're staying on top of that, and it's interesting because we're seeing it in more than a couple of places that hospital CEOs and executives are taking cuts or even donating their pay to employee assistance as COVID-19 continues to be one of the big stories in the country. What are some of the stories you're hearing about that?
Well, I was just floored when I heard some of these reports because it's incredible how stressful the jobs of leaders are in healthcare right now amidst a tremendous amount of regulatory change for needs for their staffing, change for needs for equipment, sicker patients. So this was absolutely fascinating to me that they were donating their salaries in this time frame. But I think that they're just being true leaders and true to their employees and true to their patients, which is incredible.
Yeah, no doubt. I mean, that's when you put your money on the line, when you're saying, I'm putting my money where my mouth is, that means a lot to people, doesn't it?
Exactly. So I read a report that the HCA CEO, Sam Hazen, donated 100% of his salary for 2 months to his employees' fund. And HCA, when I read about it, didn't have any press releases related to it. It was just happened to be picked up by somebody. So I thought, well, you know, he wasn't doing it as a press stunt. Let me look back at their mission statement, and their mission was basically to take care of their people. And so that fit with the mission of the hospital and the hospital system. But if you think about it, he has to keep up with regulation changes in all the states where his hospitals are, plus all of the reporting changes, plus new protocols, plus new legal requirements, plus staffing changes and budgetary changes overnight. I'm sure he's working around the clock.
Yeah, no doubt about it. And, you know, you're seeing examples of this through Ohio, through the Midwest, even out into the coasts. Do you think that these CEOs, these people of import in the health business, are they doing it because of peer pressure? I mean, they see their peers doing it, so like, oh, I got to do something too. Or do you think that's just how those people are wired?
Well, I've talked to leaders of healthcare systems before, and they talk about graduating from their graduate degrees and saying, I could have gone into. Some of them have masters in business, and they say I could have gone into a different industry, but I chose this industry because I had the potential to help people. Mm-hmm. So, you see that they're business-minded, but they chose the industry because of the impact that they could have. So I think that with that in mind, I believe they're wired slightly differently, and I think that their mission, they talk about their mission and their people so much that they buy into that and really are standing behind it. I'm sure there's some peer pressure. I see that there are 45 hospitals on the list that I'm looking at. But you don't give up your salary over peer pressure.
Well, I mean, that's the thing. There's a lot of people right now, whether they're furloughed, they've lost their job or whatever, they're desperate to have any kind of income at all. So I think, when you got someone that's working at full pay and has a big job, I mean, they really have a lot going on, as you've illustrated very nicely. The fact that they're willing to donate, to give to the greater good, I mean, that just speaks to people.
Sure. And, when I go into my job as a healthcare worker right now, I have increased risks. I'm around patients who have coronavirus. And then you think about all the departmental leaders are around me. And then they go to their leadership, and their leadership then goes to the CEO of the system. They're exposed to additional risk, and it filters up to them because of the amount of contacts that each of their contacts have. So, they're exposing themselves to extra risk, and that means exposing their families as well. And so it's not actually a risk-free environment to do this in. So it's the stress plus the risk.
Yeah. So what we know, I mean, we've been living the coronavirus pandemic era now for, better part of 3 months. In your mind, being a healthcare professional, in the last month or month and a half or two, I mean, have things changed at all? I mean, what we're doing from the beginning is what we should still be doing as far as trying to take care of ourselves and stay healthy?
I think that as healthcare workers, we've advanced a lot in our understanding of the virus and of treatments and potential treatments. So, we've learned a lot about ventilators and what kind of ventilator settings to use, and then also high flow oxygen and how well that works. When it comes to practices that help reduce the risk of spreading the disease. I think that, wearing masks and social distancing are the two things that we found help the very most, and washing your hands. I guess those are three things. Washing your hands as well really impacts the spread of this disease. Until we have a vaccine, I think that those are the three things I recommend the most.
Yeah, and what are you hearing about vaccine, by the way? I get reports, here and there. It seemed like maybe a month ago there was a lot of churn because there were some organizations, some entities that were really making some strong ground. We're doing some testing and, had people in the queue and all that. But it seems like in the last at least 3 weeks, there hasn't been a lot of real hard information about vaccines. What are you hearing? So
the company you were hearing about a few weeks ago made an announcement. Moderna made an announcement that they went from phase 1 to phase 2 clinical trials,
right,
which is the first time a vaccine of their type has ever made it from phase 1 to phase 2 trials.
Okay.
So that was groundbreaking as it was. It turns out that if they make it through phase 2 trials, they'll be in the last phase before they can market the drug. And they are predicting that they'll be making an announcement sometime in the end of this month as far as whether or not they're going to move from phase 2 to phase 3. When I look at MIT papers on looking at kind of all of the medication trials, they show studies of predictions of percentages of who gets through, how many of these trials go through phase 1, phase 2, phase 3.
Mm-hmm.
And it looks to me like phase 3 trials have a 60 to 70% chance of being successful.
Wow.
So if they, at the end of June, announce that they are going from phase 2 to phase 3, then I think we got a 60 to 70% shot at a vaccine happening.
And that would be, you think, by the end of the year?
So they have already partnered with a manufacturing company that has manufacturing plants here in the United States and in Europe. So that would be great from a distribution standpoint for us and for Europe. And that manufacturing plant solidified their deal with Moderna a few weeks ago. So I am sure if I were them, I'd be hiring a lot of people, buying a lot of machines, and testing all my protocols, and maybe even making some of the vaccine and putting it on the shelf until we can sell it, right?
Absolutely.
So I imagine that's what they're doing. It turns out that mRNA vaccines are different than DNA vaccines. Without going into a whole bunch of kind of boring basic science, the DNA vaccines, some of them are live, and some of them have to be grown in eggs, which is why they ask you when you get a flu shot, do you have any egg allergies?
Right.
And we all know that eggs are fragile. I've broken a few. And we all know that they cook at just a warm stovetop temperature. So you have to handle them in very fragile conditions. Well, Moderna is just making proteins, and those proteins are easier to manufacture, and so they're more predictable in their manufacturing, and they're faster. So it'll be the first time we're manufacturing an mRNA vaccine, but not the first time that we're manufacturing proteins as a medication.
I gotcha.
So I think it will be, my guess is that it will be faster to produce and less costly to produce, not necessarily less costly to the customer. So we'll see. I think that could play into us getting it by end of year.
I gotcha. That is really wonderful information. Katie, thank you very much for the update. Dr. Katie Jarvis there, founder and CEO of BedBeacon at SMU.